We've had a health forum tonight called Shine the Light on Goulburn. We had representation from our current sitting member and potential candidates from the other parties.
We have three issues before us this evening. The first is the issue of Goulburn Hospital. The second is the issue of nurse ratios, and the third is the issue of Medicare.
The question for Goulburn is, what will your new hospital look like? Who will own it and operate it? Will it be a privately operated, privately funded hospital delivering some public services? Or will it be a public hospital delivered by the public for the public?
You build a private partnership, public partnership in this city, it'll only be the wealthy that benefit from it, and we need a public hospital.
So the planning is only in its early stages. We've obviously developed now a clinical services plan which has to be taken forward.
Overwhelmingly they're remarking about how under-resourced the hospital is. It's past its use-by date, needs updating. They don't have the amount of medical professionals on hand that they need.
A little bit of debate about whether we would go and get a new hospital. Then most of the focus turned to staffing. And it was a good opportunity to bring forward the case of what we are fighting for, which is the ratio.
You commit to supporting nursing ratios of 1 nurse to 3 patients in Goulburn's emergency department.
I don't think you can make the case that people in Goulburn don't receive a high quality standard of health care.
And how is it possible to attract more nurses to the profession when nurses are just continuously being kicked in the guts? You're sitting on Sagpro and you're saying that we've got this wonderful system that works perfectly, and then you've got a room full of nurses telling you it's not.
But it clearly isn't the problem today in terms of shortages of nurses. That it might be in 10 years, but it's not the problem today. But we deal with the problems of today, and as we can, we plan for the future. But it's a big ask for even a big state government like ours to take on planning for nursing in 10 years' time.
Emergency departments are vital in communities like this, where rural health is already overrepresented in terms of poorer outcomes, sadly slower response times and more challenges.
There's no doubt there's a benefit to nurses if there are more of them. That means that they can do their job. They can do their job without going home feeling guilty that they've shortchanged their patients, that they haven't done the right thing by their patients.
If you have lower ratios of nurses to patients, then the outcome of that is very poor, and it actually has a mortality attached to it.
And I absolutely agree that as the clinical evidence becomes available, that it's better to do it this way than it is through the method that the hospital administration has adopted. If it is demonstrated that the ratio is a better way of providing the health care that people need, and that it affects materially people's recovery rates, the death rate, and all the other things that go with being a better society and a healthier society, then I think it happens. But remember, it depends on wealth.
As usual, it comes down to funding, but how do you measure a person's life and a person's outcome? It shouldn't come down to money.
Personally, I want to know that I'm going to get the right care and my family's going to get the right care.
I'm just really encouraged that the community of Goulburn is getting behind the local unions and really critiquing the politicians and asking them to put their money on the table and show us what you've got.